Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Here's what Mayo Clinic and the NIH actually say about vitamin D deficiency. It's one of the most common nutrient gaps globally, affecting an estimated billion people. Yet most never realize they have it. Why? Because early symptoms are subtle. You might feel slightly more tired, experience muscle aches, or have trouble sleeping and never connect it to vitamin D. By the time serious symptoms show up, months or years have passed. That's why understanding what to look for and how to get tested accurately is crucial. This video walks through the actual signs, the tests that matter, and how to interpret your results so you can talk to your healthcare provider informed. Vitamin D is technically a hormone your body produces when skin is exposed to sunlight, but you also get it from food and supplements. According to Medline Plus, vitamin D plays multiple critical roles. It helps your body absorb calcium for bone strength, supports immune system function, and regulates inflammation throughout your body. Your kidneys convert it to its active form, which circulates through your bloodstream. The challenge? Modern life reduces sun exposure dramatically. Indoor work, sunscreen use, geographic location, and seasonal variations all limit the UVB rays needed to produce adequate vitamin D. For many people, food and supplements become the primary source. Understanding this is why testing isn't optional. It's the only way to know your actual status. The CDC notes that specific populations have markedly higher deficiency rates. People living in northern climates see reduced sun intensity, especially in winter. Those who work indoors most of the day simply don't get enough exposure. Individuals with darker skin tones in low sunlight regions need more sun exposure to produce adequate vitamin D. Older adults have reduced skin synthesis capacity. And here's the kicker: sunscreen, while protecting against skin cancer, blocks the UVB rays needed for vitamin D production. The pandemic accelerated indoor work trends, and seasonal changes worsened deficiency in winter months. This combination explains why deficiency is so widespread and why proactive testing has become more important than ever. According to Mayo Clinic, early vitamin D deficiency often shows up as persistent fatigue and generalized muscle weakness. You might feel exhausted despite 8 hours of sleep or notice muscle aches that don't match your activity level. Some people report bone pain, particularly in the lower back, pelvis, or legs, that feels like a dull, persistent ache rather than acute injury pain. Sleep disturbances are common: difficulty falling asleep, staying asleep, or waking unrefreshed. Some experience increased susceptibility to colds or frequent infections. Here's the problem: these symptoms are vague and easily attributed to stress, aging, or overwork, so they go undiagnosed for years. If you're experiencing persistent fatigue or widespread muscle discomfort without a clear cause, it's worth discussing with your healthcare provider and requesting testing. If deficiency goes untreated for extended periods, more serious complications can develop. Cleveland Clinic research indicates that chronic severe deficiency can contribute to osteomalacia, bone softening in adults, which significantly increases fracture risk, especially in older adults. Rickets can develop in children. Mood disturbances, including seasonal depression and mood swings, are documented in the research. In severe cases, some patients experience muscle cramps, weakness that impairs function, or increased susceptibility to infections because vitamin D supports immune cell development. The NIH emphasizes that children, pregnant women, and older adults are particularly vulnerable to complications. That's not meant to alarm you, but rather to highlight why early detection through testing is important. You want to catch deficiency before it progresses to these stages. The standard diagnostic test is a simple blood test measuring 25-hydroxyvitamin D levels. It's the best and most reliable marker of your vitamin D status, according to Medline Plus. You don't need to fast, and the test takes just minutes. Most primary care doctors can order it, or you can request it directly at urgent care or private lab services. When you ask your doctor, mention if you have symptoms, live in a location with limited winter sun, work indoors, or have risk factors. Many insurance plans cover vitamin D testing, especially if you have documented symptoms or risk factors, though some labs charge between $30 and $80 out of pocket if uninsured. The results come back measured in nanograms per milliliter, ng, which is the standard measurement used worldwide. Here's what the numbers actually mean. According to Medline Plus and Mayo Clinic standards, levels below 20 ng/ml are classified as deficient, 20 to 29 ng/ml is insufficient, and 30 ng/ml and above is generally considered adequate for most adults. However, and this is important, emerging research suggests that levels of 40 ng/ml or higher may be optimal for bone health, immune function, and overall wellness, though this remains somewhat debated in the medical community. Individual targets vary based on your age, specific risk factors, underlying conditions, and family history. That's precisely why interpreting your results with your healthcare provider is essential. They know your full medical picture and can tell you whether your level means you need lifestyle adjustments, supplementation, or further investigation into underlying causes. Beyond lifestyle and sun exposure, certain medical conditions significantly increase your deficiency risk. According to Cleveland Clinic, people with digestive disorders like Crohn's disease, ulcerative colitis, or celiac disease often struggle to absorb vitamin D properly. Kidney disease impairs the critical conversion of vitamin D to its active form. Liver disease affects vitamin D metabolism. Older adults naturally have reduced skin synthesis capacity. Additionally, certain medications, including some anti-seizure drugs, glucocorticoids, and antiretroviral drugs, can interfere with vitamin D processing in your body. If you have any of these conditions or take these medications, absolutely mention them when discussing testing with your provider. This medical context directly shapes how your test results are interpreted and what your healthcare provider recommends. Once you have your test results, the important next step is a conversation with your healthcare provider, not internet searches or social media. They'll review your specific level, review any symptoms you're experiencing, and look at your complete medical history to determine the right path forward. Some people benefit from increased sun exposure and dietary sources of vitamin D like fatty fish, egg yolks, and mushrooms. Others may need supplementation, though the specific dose and duration depend entirely on your situation and shouldn't be self-prescribed based on internet recommendations. The goal is reaching and maintaining adequate levels while investigating any underlying conditions that might be contributing to deficiency. This is a collaborative process between you and your clinician, not something to tackle alone. Testing is simply the crucial first step toward understanding your actual health status and making informed decisions.